Hello everyone, I'm Dr. Suresh, Senior Consultant Maxillofacial Surgeon, Gnathos Face. Recently one video is going viral in Facebook and other social media channels. An interesting incident happened where a 24 years old passenger traveling to Kanyakumari in a train had a dislocation of the lower jaw. So luckily the patient was treated by a railway doctor at a Palakkad junction where the jaw was reduced manually and the patient could complete his journey successfully. Now in this video, we will understand what exactly happened to this. Is it a rare thing or is it something common which most of our patients are suffering without the proper awareness of knowledge of jaw dislocation? So jaw dislocation, basically you have something called as lower jaw, which is the only movable bone in your joint in the face. There's something called as TMJ. In cases where someone yawns widely or sneezes, the jaw dislocates from its position. So this leads to unable to close the mouth and causing extreme pain. The patient pain is miserable and he will not be able to close the mouth. So this becomes an emergency situation where the surgeon will be able to identify the problem correctly and put the joint back into its position where the jaw dislocation is treated. It is something like you might have heard about the shoulder dislocation where the shoulder joint comes out of its normal anatomical position. The same way it happens to the lower jaw or the mandible or the temporomandibular joint. Why does this happen? Someone has an habitual opening of excessive mouth, we call it a subluxation of the joint. So that subluxation of the joint over a due course of time due to wear and tear changes within the joint itself will lead to the dislocation of the jaw. Now there are two types of this. One is acute jaw dislocation or a chronic recurrent jaw dislocation. Acute jaw dislocation is something which happens all of a sudden and it is extremely painful. The joint is reduced back into its anatomical position. It doesn't happen again. That is, we call it as acute jaw dislocation. This immediately you have to go and see a maxillofacial surgeon where he will be able to position the joint into a normal anatomical position. The patient will be able to open and close the mouth normally. If this happens repeatedly, as per the theory, if this happens every time when you yawn, whenever you are eating, or monthly 2 to 3 times, the joint comes off its position and the patient is unable to close his mouth. Somehow they manage to try to manipulate the joint themselves and try to close. This we call it as a recurrent jaw dislocation. This is the condition where it needs a proper attention and proper treatment. The reason is every time the jaw comes off at its normal position, there is a damage internally happening within the joint and causing more wear and tear to the joint, which is an irreversible damage. If someone has this type of recurrent jaw dislocation, please see a maxillofacial surgeon, do a relevant investigations, identify if it is a recurrent joint dislocation and treat it accordingly so that the joint wear and tear can be prevented. And repeatedly, the patient will not have this problem of dislocation where he will be unable to close the mouth or normally he can yawn, eat or normally he can talk. If you find this information valuable, please share it with the people who are in need of this condition.